Ochsner Health is teaming up with Johnson Johnson and the Zulu Social Aid and Pleasure Club to break the stigma when it comes to men's mental health. They are hosting the Real Talk Men and Mental Health this Saturday. Chief of Community Health at Ochsner, Dr. Evans Laborde, and Director of Public Relations for Zulu Social Aid and Pleasure Club, Darren Meyer, join me now with more details on this event. Gentlemen, good morning to you.
Good morning. How are you?
I'm doing all right. I'm doing all right. Thank you. And I guess that's the point here, to make sure that we're all doing all right.
Absolutely, yes. And we're really thrilled to have this event came up on Saturday. It's an incredible partnership between Zulu and Ochsner, and one of the things we're prioritizing is really removing the stigma regarding mental health, and specifically as it regards to mental health and the fact that it's really underdiagnosed and undertreated, and specifically in certain patient populations as it relates to black men. That's an area where there's a tremendous opportunity to detect it and treat it more effectively.
Why are those numbers so low?
Well, there are a number of reasons. One is that there's a general stigma in terms of the impression that people have that typically black men are supposed to be resilient, men in general, and so they don't tend to reach out for help to the extent that they may need to. And so access to care is also a critically important issue that actually is a barrier to making that possible.
Mr. Darren, having a place to go, having a space where men can feel comfortable having that conversation is also of import.
Yes, I mean, we think we're centrally located at the Zulu Social Aid and Pleasure Club. We're the everyman's club, we say, so we bring people from all walks of life, and I think it's important that we reach out and grab people to bring to this event.
Yeah, you notice that actually when you walk past, when the gentlemen are out there from all walks of life here in the city of New Orleans. It makes us all up, and I mean, that's what you're trying to underscore with this event this week, just having a space where anyone feels comfortable to talk about how they feel. Talk more about the event this weekend.
So the event is actually, it's our fourth year that we're actually having it. And so what it does, it actually creates a space whereby individuals can come in a place where they're comfortable, culturally appropriate, and open to discussion. And in addition to that, we're also going to be providing access to a lot of diagnostic and screening opportunities as well. And we're going to have an event where we're going to have a panel. So we're going to bring really specialists on the topic who actually answer questions directly to the men in an open and culturally inclusive space.
Yeah, I'm looking forward to that conversation. I'm going to be moderating that panel conversation. Let's talk about that culturally inclusive space. Mr. Darren, how important is that? And how important is it in the larger conversation about making sure that mental health is of top priority?
It's very important. Again, we talked about all walks of life. People are going through a lot during their jobs, economically, socially. And so we want to bring them all together for this discussion. But the important thing is that you can also get extra screenings. Early detection is important. I'm 2.5 years removed from prostate cancer. So it was early detection that helped me with that process.
Thank goodness for
so
that.
I think it's important to get these screenings early.
It is very important, Doctor.
No, I guess to that point as well, the early screening is also important in terms of mental health, because people don't realize when you think about mental health in men, people don't realize that actually suicide is 4 times higher in men as opposed to women. And so it's really important to screen for mental illness as well to prevent more adverse effects later on.
How do you screen?
Well, there are a couple of tests that you can actually do. They call them PHQ testing, that you actually ask questions to actually reveal some of the questions, some of the issues that may be there. But it's actually, it's expected as part of the annual screening evaluation that we actually screen patients for signs and symptoms of a mental health disorder.
All right. Well,
and that's really critically important. The only thing I would add is, in fact, that 1 in 3 patients actually don't actually receive the appropriate treatment once they've actually been diagnosed. And so it's important that the screening is important, but also follow up on a regular basis with your physician to ensure that we actually provide the support and the care that you need to address this really critically important issue.
All right, very important. We do thank y'all again for coming on that conversation. Real Men Talk, Men and Mental Health, excuse me. That's Saturday, 10 to 11 over at the Zulu headquarters on North Broad Street. Got a link on our website. Go there. You can register to attend. More information there, I should say.